And promises hit reality, cash, and how real people actually behave. The trouble with promises is that you kind of, one day, have to follow them through. Today we'll be discussing the very limited range of options on the migrant surge and the outlook for COVID-19 this winter, with Sajid Javid, the Health Secretary, and with Nick Thomas-Symonds, the Shadow Home Secretary. Brexit tempers seem to be cooling, but can a solution to Northern Ireland be found? I'll be talking to Maros, Sefcovic, the EU Commission Vice President. With coronavirus rates soaring across Europe and increasing anger over lockdowns and compulsory vaccinations, I'll be talking to the EU's top COVID advisor, Dr. Andrea Ammon, and by one of the creators of the AstraZeneca vaccine, Professor Sir Andrew Pollard. Now, before we crack on, a brief word. You may have seen or read that I'm leaving the BBC after 21 years. Now, I'm carrying on until Christmas, but I really want to say this. Not very much. You watch this programme, I hope, for the guests and their stories, not the presenter. It's always about the stories and not the storyteller. And so on with those stories, lots this morning, and reviewing the news, the founder of Money Saving Expert, Martin Lewis, and the Sunday Times' political editor, Caroline Wheeler. But first, the news headlines from Seema Katecha in Salford.
Good morning. There's been another night of rioting in the Netherlands against new lockdown rules amid rising COVID-19 cases in parts of Europe. Protests have also taken place in Austria, Croatia and Italy after some governments moved to bring in new restrictions. The Foreign Office has joined international calls for China to prove the tennis player Peng Shuai is safe and well. Chinese state media has posted more footage claiming to show the star living freely, but the videos have not been verified. She's been missing since claiming in early November that she was sexually exploited by a former high-ranking government official. The Health Secretary, Sajid Javid, has said it's unacceptable that some medical devices used by the NHS may be less effective on black and minority ethnic patients. Mr Javid has commissioned a review into racial bias in equipment, including oximeters which measure oxygen in the blood but tend to give inaccurate readings for people with darker skin. And in sport, Manchester United have lost again. So is this a wave goodbye? Manager Ole Gunnar Solskjaer now looks set to leave the club following yesterday's 4-1 defeat to Watford. That's all from me. The next news is on BBC One at 1. Back to you, Andrew.
Many thanks, Seema. And now, as you'd expect, to the front pages. The Sunday Times has our guest later on in the programme features. Sajid Javid is ordering a racial bias review after COVID deaths in hospitals. Basically, some devices work differently on black and brown skins than they do on white skins. Very interesting, that story. The Observer has the Prime Minister being told that his plans for changing the social care charges are going to produce a Tory rebellion. There's a lot of Conservative anger with the Prime Minister in different ways in the papers today. The Sunday Telegraph, migrant crisis puts Tories in peril. They're looking at the polling on that, and they say 77% of people, 77% I should say, of Tory supporters think the government is not being tough enough on the migrant crisis. Again, we'll be talking to Sajid Javid about that. The Mail on Sunday has a story about the BBC. This is a very traditional story. It comes around and around. The royal family and the BBC are again at war, this time over a documentary about the two younger princes and their briefing against each other. Now, as I say, Boris Johnson features on almost every single paper today, and two very different takes. Bare-faced cheek of Boris, says the Mirror, Sunday Mirror, talking about him not wearing a mask on a train. The Sunday Express, which is still a supporter, Boris is still a winner, it says. There is a but in that story, which we'll talk about shortly. Before we do, Caroline, let's talk about your paper, The Sunday Times, and your story. Sajid Javid is worried about institutional racism inside the NHS.
Yeah, it was really fascinating. This was something he personally brought to us. It's something he's very passionate about. And basically, having taken up the role as Health Secretary, he realised, particularly during the pandemic, there was one particular piece of equipment. It's the oxyometer. It's the thing you put on your finger to measure oxygen levels in your blood that basically doesn't work very well on darker skin. And of course, there are concerns that that would have stopped people who should have been in hospital getting that really life-saving treatment.
So that simple piece of equipment not working as well as it should may have caused many deaths from COVID.
Yes, I mean, if you look at the statistics about obviously the number of people with black and ethnic minorities that died of COVID compared to those with white skin, there is a problem there, and there's been lots of people trying desperately to work out what that may be. But I think what the Health Secretary is saying is this has sparked him to think about what the wider implications of this can be, particularly if you think about sort of medical equipment is largely designed by very rich white nations, whether or not they just simply haven't tested these devices on people with different coloured skin, and it's as simple as that. And what he wants to do, and says in an article for the Sunday Times, is he wants to look at introducing international standards. So basically you can't sell this equipment unless it's been tested on ethnic minorities and women.
And the man himself is the source of this story.
He is indeed, and he seems to be very passionate about it.
OK. We're talking more generally about COVID and rich white nations. One rich white nation in particular, Austria, has got mandatory vaccinations coming in and lockdowns coming, and there have been really, really angry and indeed violent protests about this. I suppose one of the big questions in the papers today is whether any of that is coming to our shores as well.
Yeah, absolutely. I mean, this has been the thing that's been worrying people for some time. But I think the thing that's really striking in the coverage today is actually, if we look at our own vaccination rates compared to those in the rest of Europe, we were very much ahead of the curve in all of this. So even now, we've got more people with boosters coming online than they have there. So their immunity is waning already.
We've also been running hot.
Yeah.
Unlike other countries, you know, we've had this caseload for a long time, which means people will have some natural immunity. There's a really interesting point in the Sunday Times, a little poll here. People won't be able to see it. But of course, we've been a divided nation over Brexit for a long time. And since we've been a divided nation over vaccines and COVID. But while a number of months ago, the vast majority of people were in supporting of COVID protection measures higher than looking after the economy, those the two lines have now intersected, so it's pretty much a 50-50 split. Only slightly more people are in favour of, you know, keeping COVID protections over opening up and keeping the economy going. And that's a big change, I think, in the country.
That's a big change, and that is, in a sense, in the direction that Boris Johnson himself has been going. But he has some big problems in the papers as well, Martin. We're going to be talking about social care with Sajid Javid. Now, this is a complicated story, but it's going to affect a huge number of people watching this programme, so we have to try to explain it as simply as possible. The government have changed the rules about government aid for people who are hoping for social care.
Well, yes, what they've actually done is clarified what they're going to do. Everyone had assumed they were going to follow Andrew Dilnot's proposals because that was the language they talked about. Now, within the Dilnot proposals, there are two protections for people on social care. One is a cap, £86,000. You won't have to pay more money than that. And the other is there's a means test where the state will fund some of your social care. And in his proposals, the two interacted. Now, what's happened is the government said they're not going to interact. So effectively, what that means is it was thought that if you got means-tested support and the state paid for some of your social care, that would go towards your price cap, along with any private funds you put in. But now it won't. So if you're very wealthy, you wouldn't have got any means-tested support. So
you're not going to be affected.
You're not going to be affected. But those on lower incomes and with less wealth, the means-tested support doesn't matter. They're still going to have to pay the £86,000 cap. So there's quite a regressive change. It's really going to be quite damaging towards people on lower and middle incomes in the social care cap.
And it presumably means that people whose houses are worth relatively less than rich people in the south in particular are going to have to sell their houses to pay for this.
Yeah, so certainly geographically it's going to affect those in the north more, although there are still many people in the south with low incomes and low value houses who are going to be affected too. And you can see where the revolt is coming from, because the assumption of how this would work was wrong. The government said it's going to be different, and it looks like they're leading on what the Treasury wants rather than actually looking at whether this policy is a just one.
So, Karen, let's look at the politics of all of this. Since you're the political editor of the Sunday Times and know about this, this is very much these so-called Red Wall Northern and Midland seats. That's where people are particularly angry. And one of the papers calls this an inheritance tax on the Red Wall seats. How serious is this going to be for Boris Johnson if they don't get it right?
Well, actually, I think given all of the things that we've seen happening with the Sleaze row and then the fiasco over the rail track to the north, I've actually heard more about this than I've heard of anything else over the last week. People, particularly MPs in the Red Wall seat, seem to be very, very angry about this. They feel like it was sprung upon them. There's been no impact assessment. They really want to know why this has happened without any explanation. There may be a vote on it in Parliament this coming week, and people are pretty angry about it. In fact, one Red Wall MP was saying to me that he believes that there will be a number of first-time rebels if that happens, and actually people that have been previously loyal to Boris Johnson may vote against the government for the first time. And
Caroline, there are two papers who have always been really solid supporters of Boris Johnson the whole way through, who are saying we're still backing you, but. So we've got the Sunday Express I showed at the front. They're saying, you know, Boris Johnson is still a winner, but he has to do something about this migrant crisis. And The Sun has a very interesting piece by his biographer, Andrew Gimson, saying he's fine, but he's got to do a lot more for the Red Wall seats.
Yeah, it's really interesting when you get these two very supportive papers, as you say, basically firing a warning shot at the Prime Minister and saying, actually, things have got to change. I find it interesting that one paper is really taking the migrant crisis. Actually, I haven't heard MPs talking about that as much as I've heard them talk about other issues, and I think that's because people can see that the levers that the government has to pull are fairly limited, and actually we have a bill that's going to address some of this coming forward not too soon. But I think the real issue here is there's been a lot of mishandling of government business over the last couple of months, and people are getting really frustrated with that. And I think you kind of reach a tipping balance, really, which is when Boris Johnson is an electoral asset, they will continue to support him. But when they see that that's not going to be the case anymore, a lot of people saying if he's not a winner, then they won't back him. And actually his base of support is actually a lot thinner than you would expect. He doesn't drum up a lot of loyalty, in that he doesn't do a lot of that kind of pressing the flesh that other prime ministers perhaps might have done more of.
So, Martin, these stories come and go. You know, prime ministers have trouble every single weekend. You know, there's the stories about potential revolts again and again and again. But underlying all of that, there is the cost of living problem. And that's the kind of thing, presumably, that can stick.
Both can stick and we know is going to get worse. So the totem for the cost of living problem is energy bills. And people will know in October we saw the price cap increase by about 12%. But because of the energy crisis, there is this looming date of the 1st of April, when it's likely the current price cap is around £1,280 a year for someone with typical use. Well, at the current run rate, it's going to move to £1,700 a year, which is a monumental shift and incredibly damaging for people's pockets. And I think with that coming, the government has not got a solution. It has absolutely no way to change that. And once that really starts hurting people's pockets, you can do everything else you like. But we all know when you start to hurt people's pockets, then you have a real electoral problem. And the cost of living crisis is not going away, certainly not until October next year at the earliest.
And it's simply too expensive for the government to do anything about it. Now, as people are kind of looking around at their finances, lots of them will be investing or hoping to invest and looking on the internet. And they'll see your face and they'll see Richard Branson's face advertising all sorts of interesting looking ways of protecting and growing your money. And you are very, very worried about this. Just tell us about your campaign.
Well, there is an epidemic of scam adverts in the UK, an epidemic of scams. It is a totally unpunished crime in this country. You know, you can do a scam and take people's money virtually with impunity. There is a real problem. And the government has the online safety bill going through Parliament. What it's decided to do is it said that if a scam is a user post, that will be regulated. But if it's a paid for advert, so the ones that big tech are actually paid to publish, it won't be regulated. And those are the scams that I appear in all the time.
Nadine Dorries, the Culture Secretary, says that she would love to help you, but she can't for legal reasons.
Well, we've also, Rich and I have written together to her and said, can you publish your legal reasons? Because what are legal reasons? None of the lawyers we know are saying there's a legal problem. What you have to understand is by regulating user-generated scams and not regulating the adverts, the government's proposal is going to mean more scam adverts because the criminals are going to start putting more scam adverts. And every day there are people in this country whose lives, not their financial lives, their lives are being destroyed by scams because the impact on your mental health and self-esteem when you're scammed is horrendous. And we are desperate to get the government to put scam adverts in the online safety
Well, listen,
bill.
I'm sure Nadine Dorries, a warm supporter, I'm sure, an enthusiast for this programme, will have been watching that and will have got the message. Thank you both very much indeed, very interesting. And so to the weather.
So a change in autumnal weather type. We have got some blue skies, plenty of sunshine out there through the course of today, but also some scattered showers, particularly across parts of eastern England and eastern Scotland as well. A little bit wintry, some of those showers this morning across the higher ground of Scotland. Rain and perhaps some hail showers mixed in for parts of eastern England. And the wind is going to be quite gusty as well, so gusts of about 30, possibly 35 miles per hour down those eastern coasts. Temperatures only between about 6 to 11 degrees or so, but feeling cooler where you've got the showers and the winds there in the east, whereas further west, actually a lot of dry weather with some blue sky lasting through the day. And then once the sun sets through the course of tonight, then most of the showers ease away, a few continuing in the far southeast and a bit more cloud and some patchy rain for the north of Scotland too. But in between, in those clearer conditions, it's going to be another cold and frosty night. Heading through the day tomorrow, then plenty of dry, sunny weather on the cards. Still some showers working into the far southeast, slightly cloudier in the far northwest as well, but certainly not as warm as it's been over the past few weeks, with top temperatures tomorrow just 7 to 10 degrees. Andrew.
Sarah, thank you very much. Now then, on Thursday, more than 1,000 people crossed the Channel to reach the UK in small boats. It was a new record. More than 24,000 migrants have crossed the Channel so far this year. Nick Thomas-Symonds is the Shadow Home Secretary. Welcome, Mr. Thomas-Symonds. Let me ask you, I know that you'll be highly critical of the government, and you can say this is a really serious problem. But before we get to that, what would be your own practical answers to solving it?
Well, good morning, Andrew. Good to join you. And you're absolutely right in your opening that there are thousands of lives being risked in the English Channel on a day-to-day basis, I'm afraid. And the Home Secretary's incompetence on this matter is dangerous. What would I be doing as Home Secretary? Yes. Well, I would be, firstly, getting an effective deal with the French authorities. The issue with Priti Patel is that she's more interested in a diplomatic spat than she is in a workable deal. And the deal as we have it focuses on the coast, it focuses on patrols. Now, I'm not saying that isn't important, it is, but we also need in that deal to be looking upstream. We need to be looking away from the coast to disrupt these vile people smugglers on the long routes, the long, well-established routes that people have taken to reach northern France in the first place. Secondly, can I just finish this point, please? Because secondly, what I would be doing is looking at the issue of safe and legal routes, particularly the Dub scheme, for example, named after Alf Dubs, who suffered persecution by the Nazis, of course, in the 1930s and escaped on the Kinder transport. I would be reinstating that safe and legal route. And thirdly, we would be reinstating the 0.7% international aid target and the Department for International Development, which was the very money going to tackle the migrant crisis, to try to prevent people becoming displaced from their homes around the world.
Well, let me look at your first answer there, which was more the solution part of it, which was a better deal with the French, because Priti Patel is offering the French quite a lot of taxpayers, British taxpayers' money, £54 million. The French have a 93-mile coast to protect, and I just put it to you that it is unlikely, unreasonable to expect the British taxpayer to pay enough to protect that entire coast, or to expect the French to be able to do that. In other words, we are not going to be able to stop this by blocking people off on the French coast. It's too long, it would cost too much, and no one's going to pay for it.
Well, that's precisely the point I was just making. Andrew, that exclusively looking at the coast is not going to solve this problem. I mean, Priti Patel is spending somewhere in the region of a couple of £1 million a week. I think the government spent in total over £200 million on this. And you have to look at the sophistication of these vile people smuggling gangs.
What would you be offering? I'm sorry. What would you be offering the French? What would you be giving the French that this government isn't to solve this?
What I would be saying to the French is that this is a shared problem. We need to be working together, not just as the United Kingdom and France, but with other countries too.
But what would we be offering them this government isn't?
Well, what I would be offering them, which this government isn't, is not simply shouting at the French government about failure to act on the coast. What I would be saying is that there is a shared issue here which needs to be dealt with by more joint law enforcement operations away from the coast.
You really think that a friendly conversation will solve this?
No, no, Andrew, that's not what I'm saying at all. What I'm saying is we have to move beyond looking at it exclusively in terms of the coast and actually be willing to look at joint law enforcement on the routes that these vile people smugglers use much further away, often thousands of miles. And what I'd be saying to the French is that can be the focus, as well as the coastal patrols that are happening, a far better joint approach tackling this issue upstream.
So there used to be a system whereby asylum seekers could be sent back to the first safe country they arrived in, and it was called the Dublin system, or the Dublin Agreement. It was part of the EU agreement. Would you be renegotiating that to return to that? Because it makes a huge difference in terms of who can be sent where.
Yes, I would be doing that as Home Secretary, and where there are failed asylum claims, and we can do that return to safe countries, we should be doing it. It is another comprehensive failure from this government that they haven't negotiated those successor agreements. It should be a top priority for them, and it clearly isn't. But
the price of going back into Dublin or something like Dublin will be free movement. Is that a price worth paying?
No, it is. No. Firstly, the next Labour government will not be reintroducing free movement, but a successor to the Dublin III scheme does not mean that, in my view, Andrew, and it's been a complete failure of the government.
The scheme itself means that.
Yes, but we're talking about a successor to it, a replacement to it, which the government says it wants to negotiate with various countries. The point is, it's failed to conduct those negotiations and failed to complete those agreements when it should have done.
So one of the ways the government is trying to resolve this at the moment is to agree with third-party countries that migrants can be sent there for processing, and therefore removing some of the pull factor to Britain. And there've been rumours that they're talking to Albania, for instance, about putting transit camps into Albania. Now, you're against that. Why?
I'm against it because I think it's an unconscionable proposal. If you look at where it's been used around the world, there are often issues with rights in the particular centres. But let me just say this too. The government, yet again, has talked about talks with Albania. The Albanian ambassador, the Albanian government, have said it's fake news. So what on earth is going on when you have the Home Secretary claiming talks are taking place that another government says are not? Is quite frankly breathtaking. But in any event, that is even being considered is yet again evidence of the desperate situation the Home Secretary has got into because of her own failure. It's the Home Secretary who promised to make this route unviable, and yet on her watch we are seeing the numbers increase to such an extent that if the rate of numbers were to increase by the same rate again next year as it has this year to last, we'll have more people risking their lives in the Channel than voters in Priti Patel's constituency.
All right, on that thought, thank you very much indeed, Mr. Symonds, Thomas. There have been angry protests across Europe as cases rise, and in some countries, restrictions on COVID-19 are being reimposed. Now, we're going to talk about the UK in a minute and why it isn't facing the same difficulties, at least at the moment. But first, I spoke to Dr. Andrea Ammon, the EU's leading COVID advisor, and she's director of the European Centre for Disease and Prevention Control. Does she think things are going to get worse in Europe before they get better?
Well, we have seen in some countries already the health services at their limits. Some countries have asked other countries for help in terms of health services. And in general, it will depend on how well the measures are now established and how effective they will be.
Austria has introduced compulsory vaccinations, and as we've seen, some people are really, really angry about that. Nevertheless, do you think this is a tactic that should be used more widely across Europe?
Well, mandatory vaccination is nothing new. I mean, that has also been for other vaccines, and it is a piece in the toolbox. We have seen it might be effective in certain contexts to increase the vaccination, but it is a bit of a double-edged sword, because it might also increase resistance in people that are doubting but not yet fully rejecting the vaccine. So they could be convinced, but with these measures, they are completely rejecting.
Now, there are parts of Eastern Europe and indeed Eastern Germany where vaccine take-up has been remarkably low, and there seems to be a lot of hesitancy and suspicion about the vaccine. Why is that?
Well, in order to find out more about this, we have been contacting countries with vaccine coverage lower than the EU average in the past 3-4 weeks. And I mean, the reasons for people not getting vaccinated are really manifold. It's not that everybody who is not vaccinated is rejecting. There are sentiments like, oh, the vaccine, the virus doesn't concern me. I'm not at risk for the disease, so why should I get vaccinated? There is a lack of trust in some countries in the government that contributes to the lack of confidence in taking up the vaccine.
Do you think this new wave of the disease presents any danger for Britain?
I mean, the virus that is in Europe, it's the Delta variant, it's global, so it's everywhere. And we have always said that once a virus is established, the importation through travelers is not really adding to the necessary control effort.
Are you worried about a new variant of the disease?
Well, with the high transmission ongoing right now, there is always a risk of a new variant, yes. And so we are really monitoring very closely. We are supporting the countries in ramping up their sequencing efforts to make sure that if there is a variant, that it's detected very early.
Dr. Ammon, thanks very much indeed for joining us.
My pleasure, thank you.
Pollard is here. He's the director of the Oxford Vaccine Group who designed the AstraZeneca vaccine, which this week has passed the milestone of 2 billion doses being given worldwide. Welcome. Can I ask you, first of all, whether you think that what's going on in Central Europe and Germany at the moment is going to rebound on us?
Well, if we look at what's happening in other countries at the moment, they're just experiencing the start of another wave of spread of infection. And the reason why the virus spreads is a combination of changes in social distancing, whether that's lockdown measures or mask wearing, plus the immunity in the population. We've actually had some spread going on since the summer. And so I think it's unlikely that we're going to see the very sharp rise in the next few months that's just been seen.
In a sense, we're ahead of that.
We're already ahead of that with this particular virus, the Delta variant.
Now, it's very easy to take things for granted, and we take for granted now the fact that we've got a vaccine, but it wasn't inevitable. Can I ask you where we would be now without the vaccine?
Well, today, obviously, we have, with the Oxford vaccine, got to 2 billion doses. But if you look at all of the developers, we're at 7.6 billion doses out there. And without those 7.6 billion doses globally, we've been in a very different situation. So if we just look at the UK, the predictions last year were that there would be between 300 and 500,000 deaths. And actually, when you look at the data on lives saved so far this year, we're actually not far off where we to actually think that that is the right number, that we might have been at around about 300,000 deaths by now without a vaccine.
That's an extraordinarily high number, which we've escaped so far. Part of the reason, of course, that we're doing well at the moment is the booster vaccine topping up. Do you think it's the right thing to extend that now to 30-year-olds and 20-year-olds at a time when a lot of the world is not yet properly vaccinated?
Well, we have different measures that can be used, and we're seeing that across Europe in order to try to limit the spread of the virus, and particularly to the unvaccinated. Yeah. And those include the measures like social distancing, lockdowns, and vaccination. And vaccines give very good immunity after 2 doses, but for infection, that does wane over time. And we've seen that we know that people can be infected and get relatively mild infections, even if they've been vaccinated. So boosters will top that up. And there's very good data just released this week from the Health Security Agency showing that those boosters will reduce the spread of the virus. So vaccinating people at this moment will have a further effect on reducing transmission here.
But in terms of younger people who are much less likely to get seriously sick, there's not an endless supply of the vaccine. Is it the right thing for them to get boosters before other parts of the world have got any vaccines?
Well, if your phone today was at about 75% charged and mine was at 5%, I think it would be easy to work out who should get the phone charger. It should be me. And of course, that's where we are today. We've got around about 75% of the whole population here in the UK vaccinated. In low-income countries, we're still at 5%. So we really do need to get doses to those populations.
There's been a suggestion that 5-year-olds should be vaccinated in the papers today. Wonder what you think about that.
Well, we are seeing lots of transmission already has happened in younger children as well as in teenagers. And so we have quite a lot of immunity building in those age groups from infection. And remember, the 2 things that actually put us in the UK in a good position at the moment. One has been that we've had quite a lot of transmission already, which boosts the immune responses that people already have, plus vaccination.
So are we pretty close to herd immunity now, do you think?
Well, it depends what you mean by herd immunity. If you mean stopping the virus so it can no longer spread, that's not going to be a thing. Unfortunately, this virus is going to be with us for the decades ahead. If you mean slowing it down, then that's something which the vaccines are already doing.
I was thinking, week after week, month after month, I've been sort of sitting here on Sundays saying, COVID is the problem, or at least behaving as if it was the problem. Are we now at the stage where it is simply a problem?
Well, from a global perspective, that's absolutely not the case. With the news today about what's happening across Europe shows that. So it remains a major global public health problem. The predictions between now and next March are for somewhere between 700,000 and 1 million deaths worldwide. So it is still a major global public health problem, unfortunately.
In this country, less so.
In this country at this moment, the balance is shifting because of the vaccine programme that has been in place.
Until, of course, there's a possibility of another variant.
Well, further variants would have to be better than Delta that's spreading. And Delta can even spread in vaccinated populations. Now, the boosters are going to slow that down, but over time, we don't know how long that boosting effect will last. So the decisions about what happens in the future to continue to slow that down are difficult to know at the moment. But variants, to be better than Delta, will have to be pretty good.
That is a very cheerful note to end on. So, Andrew, thank you very much indeed for talking to us.
Thank you.
Now then, lots of Brexit sabre-rattling between the UK and the EU over the Northern Ireland Protocol. That's the bit of the Brexit deal that allows trade to keep flowing freely between Northern Ireland and the EU. The UK has been threatening to trigger Article 16, which allows one side to press pause on parts of the deal. But this week, relations seem to have improved, with both the UK and the Irish saying, hold on, maybe there is a deal to be done. Maros is the EU Commission Vice President dealing with Brexit. Welcome, Mr. Sefcovic. Can I start by asking you whether you think, you've been to Northern Ireland yourself, you've looked at what's going on the ground. The UK government clearly thinks that this protocol is not working properly for the people of Northern Ireland. Does the EU now agree with that assessment?
First and foremost, thank you very much, Andrew, for your yet another kind invitation to your show, and also for putting this topic so prominently on the agenda, because I'm sure that it's very interesting for your viewers in the UK, in particular in Northern Ireland. As you rightly pointed out, I visited Northern Ireland in September, and I'm in frequent, I would say permanent contact with stakeholders from businesses, political leaders, civic society, and it's very clear what they're telling us is focus on the key priorities, on the problems we have to solve. And I hear all the time 4 groups of problems: supply of medicines, need to reduce the customs formalities, reduce SPS checks, and find a way how we can involve better Northern Irish stakeholders in the dealings of the protocol. And if we solve these problems, I think we are opening the ways for the smooth operation for the protocol, for new investments, which have been just announced in the course of the last week. And my really feeling is that the Northern Irish people want us to work together to look for the solutions so the protocol would work properly and in smoothest possible way.
David Frost, the UK, Lord Frost, the UK negotiator on all of this, has given this morning a fairly straightforward sounding answer to what he thinks the solution would be. He says goods which both we and the EU agree aren't going to leave Northern Ireland should not be treated as if they were moving from one country to another, because they are not. Goods going into Ireland should be checked in the Irish Sea to protect the EU's single market and to avoid a hard border. Is there anything about that with which you disagree?
I think that what was very important in the Lord Frost article was the word of urgency. And sometimes I have the feeling that if our meetings, that I'm only one who push for urgent solutions, because we've been putting on the table the proposals on solving uninterrupted supply of medicines to Northern Ireland since 30th of June. And I remember very well that Lord Frost has been telling me that what is very important for him is not only content, but also process. And therefore, I was waiting if he can deliver on that solution jointly. And I have to say that until today, this is not the case. We had some progress on Friday. If we would be still in this mode of political posturing and bringing new and new problems to the table, I don't think that we will solve the most pressing issue for the people of Northern Ireland, and therefore we might be acting alone to make sure that the Northern Ireland people will have the medicines they need. And I think this would apply to all other issues, because whenever there is the problem presented, we always find the solution. And the question is, are we in the mood of finding solutions or permanently looking for the problems?
Well, that is exactly the question.
We clearly demonstrated that if there is a genuine problem, we can find the solutions, but we have to do it, both of us, two of us, we are ready to do so. And I hope that UK will also now make the big move towards us, because we really made far-reaching proposals and put them on the table.
It's just that proposal from Lord Frost seems to a lot of people relatively straightforward. Goods which aren't going to leave Northern Ireland treated one way, goods which might go to Dublin or go to the south treated a different way. And I just wonder what there is in that you could possibly object to, and whether you still think that he is not negotiating sincerely. At the beginning of the month, you suggested the British side were not being sincere in their negotiations. Have you changed your mind about that?
I think, Andrea, I would ask your viewer the question. Would the UK accept not to have the overview of what's coming to the UK market? Would they accept it? I don't think so. And you just simply have to understand that if something is coming to the EU single market, that we have to have an overview. And I am fully aware that what the complaints in Northern Ireland have been. And therefore, what we proposed was super reduced customs formality. We are ready to reduce them by half. We reduced 80% cut in SPS checks and many other forthcoming gestures and solutions from our side. What we cannot do, we cannot undo the Brexit, especially the type as the UK has proposed it, negotiated it, and signed the agreement upon it with us. And therefore, I think that these are the framework within which we have to find pragmatic solutions. And we are in this solutions-driven mode since the 1st of January of this year, when we have this discussion about the implementation of the protocol. And I'm sure that if Lord Frost and UK would double their efforts and come us to meet in the halfway, we can resolve all the outstanding issues to the satisfaction of the people of Northern Ireland.
I mentioned sabre rattling earlier on. Now, a couple of weeks ago, a lot of people thought Britain was on the edge of triggering Article 16. Do you think that's still going to happen?
We had a change of tone in the discussions over the last 2 weeks, which I really appreciate also our discussion on these practical issues, like, for example, medicines was more constructive than before. So it's a decision of the UK government. We are doing everything possible to avoid it because, of course, it would have serious consequences, first and foremost, for the people in the Northern Ireland, but also for the EU-UK relations. And therefore, I want to stay on this positive turf.
Sure,
I want to look for the solutions, and I hope that we will have a positive engagement from our UK partners in this effort as well.
Before we stay on the sunlit uplands now, however, there have been you talk about serious consequences. Simon Coveney, the Irish Foreign Minister, suggested that if Britain did that, in other words, paused the entire agreement over the border, then the response from the EU might be to pull the plug on the complete trading agreement between the UK and the EU after Brexit. In other words, return us to world trade rules. Is that a plausible possibility, or is that just more saber-rattling?
I would say that we shouldn't go into the hypothetical negative scenarios because I am positively driven and I want to solve the solution. What I would just say is the fact that when we've been discussing the withdrawal of the UK from the EU, there was very clear sequence which we all agreed upon. That first we have to build basis for our future relations, and the basis was orderly withdrawal agreement. Then, of course, the best possible solution for the island of Ireland, which was of the protocol. And on this basis, we then built the future relationship, and which is, of course, presented in the form of the trade and cooperation agreement. So if you pull the plug from the basis, then of course you have a lot of problems, and therefore I think we should avoid them and we should focus on positive agenda and on solving the problems for the people of Northern Ireland.
All right, let me move on to something else entirely. We've seen all the protests in Austria and parts of German-speaking Europe about the new mandatory vaccination and the partial lockdowns. Do you think that's going to spread across Central Europe? Do you see problems ahead on COVID as Europe struggles with this new wave?
Clearly, we go through a very difficult period. I wouldn't hide it. I see how the rate of infection is spiraling up. And across the EU, we are looking for the best possible solution, and of course respecting that if it comes to health, the competencies are mostly on the national government's level. So what we do, we coordinate, we are offering our helping hand from the Commission, especially to those countries where is a high vaccination hesitancy, what we can do to explain better the benefits of vaccination, how can we share the best practices where very often it's better when the vaccination teams go after the patients than to push people to queue in the long queues to get vaccinated, and to provide as much information as possible to motivate the people to get vaccinated, because we see that of course the higher vaccination rate, the less exposure to the mortal danger, to the high rate of hospitalization, and I'm afraid that we are ahead of us very, very difficult months in this regard.
There's a real puzzle here as to why so few people are getting vaccinated in parts of Central and Eastern Europe. Why do you think vaccine hesitancy is so high?
I think that first and foremost, there was a huge discussion at the beginning of this year about when the vaccines will arrive to European member states, and once we have the adequate supplies of the vaccines, we had a bit of an easing up of the infections. The summer was here. It was, I would say, full of hope, and the people thought that this virus would gradually go away. Unfortunately, this is not the case. Again, we have autumn, we have winter coming, and the infections rate is spiking up again. And therefore, now I think we really need all hands on the deck, increase as quickly as possible vaccination rate, and to offer all the help, financial, professional, to the first-line responders who are the doctors, nurses, medical professionals in our hospitals, because they're under a lot of stress, I would say, everywhere in the European Union.
Mr. Sefcovic, a hard winter ahead. Thanks very much indeed for coming on and joining us this morning. Thank you. Now then, here's a look at what's coming up at 10:30 on BBC One.
Coming up on Sunday Morning Live, comedian Hamza Arshad investigates the trend for alcohol-free, halal-certified wines and beers.
We'll be asking if our consumer culture does more harm than good.
And I meet Paralympic hero and brand new I Am a Celebrity contestant, Kadina Cox. Join us at 10:30.
And now I'm joined by Sajid, Javid, the Health Secretary. Mr. Javid, welcome.
Good morning.
Let's talk a little bit about what's going on in Europe. We were talking about the massive wave of COVID in Germany and Central Europe at the moment. The Prime Minister has talked about this great cloud on the horizon, and this is going to be a wave that may well wash up on these shores. What's your view?
Well, look, as we head closer to Christmas, we can sadly see this huge surge of cases in parts of Europe. And, of course, we don't want to see anything like that happening here in the UK. We have long warned that this horrid virus, it likes the winter, it likes the cold, dark days that brings. But the one big difference here at the moment is our booster program. It's the most successful of Europe. We've done almost 15 million across the UK, some 400,000 a day. I think 25% of the population over the age of 12 already covered. And that is absolutely key for us to keep this virus at bay.
Will the booster then be passed on to people in their 30s and their 20s next?
Well, we are extending it from tomorrow, actually, to people in the age group 40 to 49, and we will keep under review how that might be extended in the future. And we're seeing record numbers of people come forward, but I would urge everyone to, if they're eligible, to do so, to come forward, because that's the best way we can look forward to the kind of Christmas that we all want to see.
Would you like to see it extended?
I'm happy with the extension, of course, to 40 to 49. But if the recommendation from the experts, because we do want to listen to what our scientists have to say on this, if their recommendation is to go further than that, we do, absolutely. And if it makes sense to go further, we will. But can I say what we also learned from our experts this week was that the latest data shows that the boosters are immensely effective. So for someone over the age of 50, when they take their booster shot, their protection rises from around 50% to over 90%. That's the difference it is making.
Would you consider stopping people coming from the continent to the UK to prevent infection spreading?
We keep our travel rules with respect to the virus and the review all the time, and you will see that every couple of weeks or so we look to see whether we need to update those rules.
So you're eyeing Germany at the moment about that?
Well, there's no plan for that at the moment, not least because what they are going through, it's the Delta variant, and we have Delta here already, so I'm not sure there'll be much benefit in having more rules, but we do keep an eye out for any potential new variants.
Now, you've seen these really vociferous protests, and sometimes violent protests in Austria, in particular, about mandatory or compulsory vaccination. Can I ask you, would you ever accept compulsory vaccination in the UK?
No. I mean, it's not, I don't. It's up to Austria, other countries to decide what they need to do. We are fortunate in this country that although we have vaccine hesitancy, it's a lot lower than we're seeing in other places in Europe. But also, I just think at a practical level, taking a vaccine should be a positive choice. It should be something that if people are a bit reluctant, that we should work with them and encourage them. So with the exception of what we've done, for example, in healthcare and social care, which is very different, you're choosing to work with vulnerable people. In terms of requiring mandatory vaccination for the general population, I don't think that's something we would ever look at.
Let's talk about the NHS directly. It's now taking nearly an hour for ambulances to reach patients, and that's a huge increase in waiting times. What are you doing to stop that happening?
Well, look, first of all, I recognise the NHS, especially A&E emergency departments, are under huge pressure. We normally see that in winter. We're seeing it a lot earlier because of this pandemic, and also we're seeing a lot of people coming forward that had stayed away from the NHS. We, of course, understand that. So what we are doing about it is, first, we're providing the NHS with a record amount of funding. So over this winter, they're getting an additional £5.4 billion for the NHS and care systems.
Is that going to get into ambulances? Because if we look at this graphic, we can see exactly the scale of the problem. Because it's meant to be 18 minutes, I think, is meant to be the waiting time, and it's shooting up now to nearly an hour, as you can see from there. That's a really big increase.
Yeah, so with the extra funding that we're putting in, that is helping. Of course, I wish we could do even more, but we've got to work with what we've got and take the advice of the NHS and provide them with all the funding that they need. So we are providing more funding for 999 call handlers, for 111, for ambulance trusts, for A&E departments, more funding for discharge of patients that are clinically ready to be moved on into care, and all of this is helping. And can I commend everyone working in NHS, because they could not be working harder.
So we're talking really about staffing here. Your predecessor, Jeremy Hunt, has said we should throw the kitchen sink at getting more doctors and nurses into the system. Are you throwing the kitchen sink at that?
I think we're doing all that we can. So in the last year, we've got, I think, so over 3,000 more doctors. We've got 9,000 more nurses, and that's great. I think the number of nurses today that we've got in the NHS is the highest number ever. We've got more students in medical school than any other time in our history. And so it's right we keep investing in that. It's right also that we plan for the long term when it comes to our workforce. That's something Jeremy rightly is also interested in, as many others. And I'll be setting out also in more detail how we can do that.
You promised an extra 6,000 GPs by 2025. Are we on course for that?
We're not on course at the moment, not for the 6,000. Now, let's wait and see where we eventually get to. We do have more GPs in general practice. We have, I think, since in the last 2 years since we made that commitment, we have we have almost, I think, 2,000 more in general practice. But we don't have, we haven't got as far as we want to get.
What's the problem?
The problem is that I think there's a couple of things. I mean, first of all, the pandemic has, no one predicted that, and that's become the absolute priority in the healthcare system.
But it doesn't stop people becoming GP.
What it does do is that it means that in terms of effort and resources, they were naturally directed towards the pandemic. But also, we are planning for the long term. We do want to see more doctors, and that is why we lifted the cap on students entering medical schools to become GPs, not just this year, but we lifted it last year as well, and all of this taken together is really helping.
So when are we going to see waiting lists improve?
It will take some time. I mean, I've been very open about this.
What does that mean? Years?
No, it will. What it means is this: is that during the pandemic, we estimate some 7 to 8 million people stayed away from the NHS. They did that because they were asked to do so, and we all can remember why. They are now coming back, rightly so. I want people to come back. I want them to know that the NHS is open to them. Alongside that, we've got the normal demand the NHS would have. And this is record demand. And that is why we're seeing waiting lists still rising. It's about 5.9 million, the elective waiting list at the moment. And I've been really open and honest about this. It is going to go higher because this is unprecedented demand. To deal with that, we need
how much higher?
And this is record demand, and that is why we're seeing waiting lists still rising. It's about 5.9 million, the elective waiting list at the moment. And I've been really open and honest about this. It is going to go higher because this is unprecedented demand. To deal with that, we need
how much higher?
I've said before that if it was business as usual, so if the NHS sort of carried on as was originally planned under the so-called